All right, here we go. All right, so we are recording and I am letting people in as we speak. Hello, everyone. Welcome out to the call. I know we're going to get some more people in here as time goes on, so I will be monitoring the airwaves. This is a recorded call. I do see my buddy Theo Alexander out there. Aloha, Theo.
What's
What's up,
up?
brother? Mahalo. How you
Hey,
doing, man?
I am doing good, man. Hey, thanks for another great event, man.
Hey,
I'm
man.
get some
You know,
good information, man. Keep it
hey,
up, man.
you know what we do, baby. You know what we do. So
Sure.
we're gonna put this thing together. Thank you for coming out from Hawaii. We've got other guests that are coming out as well. Guys, and I know this is a recorded session, so in the benefit and knowing that people are going to see this information later on, I'm gonna start this thing off, guys, by doing a quick screen share and talking about three terms that you need to know about before I introduce our guest speaker and we kind of roll into things. So I'm gonna do a screen share real quick. Okay, the screen is shared and I'm going to go here and make this full screen. Okay, so guys, this pinwheel that you guys are looking at right now is something that you need to be aware of, within the cannabis space. Now, in order to understand this thing best, I always relate this to light. If we look at light that's in a room or we're standing outside on a sunny day, we know that that is light, right? There's no disputing that. But if you're outside and if it started raining really hard and then the sun came right back out, we all know if you look in the distance somewhere, you'll probably see a rainbow. And we all know that a rainbow is a full spectrum reflection of all the colors in the light prism: your reds, your blues, your greens, your yellows. Well, it's no different with the cannabis oil, guys. When you first extract that oil from the plant, the oil that we get from the plant is what we call a full spectrum oil. But instead of reds, blues, greens, and yellows, you have different cannabinoids, okay? You have CBD, CBDA, CBG. These are just the popular ones that you're looking at right here to include your different forms of THC. You see here at the top, we've got Delta 9 THCA. We've got Delta 9 THC, highlighted in red there, and all these different others. When we talk about full spectrum cannabis, we're talking about the full array of cannabinoids. Now, Delta 9 THC is critical, guys, because per the definition, the current definition in the Farm Bill, the difference between hemp and marijuana is centered around this one cannabinoid right here, Delta 9 THC. If the Delta 9 THC concentration is above 0.3%, we are talking marijuana. Okay. But if the Delta 9 THC concentration is below 0.3%, we are talking hemp derived. And when we're talking marijuana above 0.3, we're talking a Schedule 1 narcotic, federally illegal. But when we're talking hemp, we're talking no longer Schedule 1. We're also talking legal for interstate commerce in 50 states per the 2018 federal farm bill. Now, one thing that you need to know about full spectrum: there are over 120 different molecules or cannabinoids within the cannabis plant. I'm only showing you some of the more popular ones here right now. But through time and temperature combination of manipulating this oil, you can actually extract certain things out and leave certain things in. And one step down from full spectrum, because full spectrum is the first term you need to know. The second term that you need to know is something that we call broad spectrum, okay, where we isolate certain molecules out. Now, technically, broad spectrum can be, two or more cannabinoids, but typically, when people talk broad spectrum, they have taken the THC out, the different forms of THC out, and they leave the other cannabinoids in. Now, as you see here, every cannabinoid is good for alleviating certain conditions in the body. I cannot and will not make medical claims because I am not a physician, but I'm just kind of telling you that's how it works, within the cannabis space. Okay. And we can even isolate even further down to a substance that we call isolate. It looks like a white powder. You look at a brick of this stuff, you're like, oh, is this cocaine? Oops, I'm in the wrong room. No, but it looks just like cocaine. But it's a very pure form of CBD that's been isolated down to just the CBD molecule by itself. Now, Something that's made out of CBD by itself or isolate is good for alleviating certain conditions in the body. But something made out of the isolate is not as good for you as something that's broad spectrum is in terms of your endocannabinoid system, which is the master regulatory system for the body. And we're going to go about a little detail about that. And something made out of something that's broad spectrum is not as good for you as something that's full spectrum when we talk about maximum symptom relief, homeostasis in the body, and something called the entourage effect, tied back to the endocannabinoid system. There are two primary receptors with the endocannabinoid system, CB1 and CB2. CB1 is primarily associated with brain and spinal column function. CB2 receptors are most often associated with nerve endings and immune responses. And when you give your body cannabinoids, especially full spectrum cannabis, okay, you're going to maximally support CB1 and CB2 to get to that entourage effect. Now, my guest who is going to be coming out here and giving us some information that I am very excited to introduce to you guys. She's a longtime friend, and she is someone who's literally done things in her garage with these oils. Okay. She's taken full spectrum, broken it down to broad spectrum, broken it even down further to Iceland, just done different things, with these molecules on her own prior to being curious enough to go to medical school and pursue becoming a physician herself because she knew she could only get so far, being low key with her efforts. She wanted to be mainstream and centralized with, Western medicine practices and knowing how to take certain things from Western medicine and incorporate them into holistic practices as well. And I could not be more proud of her for where she is at on her journey and what she's doing with the University of South Alabama. So, with that being said, I want to introduce you guys to my good friend, Kellie Austin. Kellie, can you hear me okay?
I can hear you just fine.
Awesome, awesome. Look at you, girl. Look how far we have come, right? From me
Right.
calling you, are you calling me, hey, Kellie, you need some isolate? Yeah, JJ, I need some isolate. What do you got? We've come a long way from those days to now. So man, I am very excited, about you and what you're doing in this space. So with that said, I gotta ask you, why did Kellie get involved with this plant? Talk to me.
Well, that's kind of strange. I've actually been a grower for like 20 years with like plants like orchids,
Uh-huh.
different types of unique plants and medicinal plants.
Mm-hmm.
And, you know, my plant inspector come to me one day after my husband passed away and he said, get up off your butt and come to this meeting over here across the bay. We need your help. And I'm like, what could I do? I mean, I just grow orchids. I mean, I don't do
Uh-huh.
nothing special. He
Yeah.
said, look, he was like, seriously, he said, I need you to come and talk to some of the farmers and they're having difficulties trying to grow everything naturally. I was
Mm-hmm.
like, all right, good. He says, you grow orchids 100% natural. You do nothing but organics and we really need your help. So
Mm-hmm.
that was where I started. I went to that meeting and I realized that these farmers really did not know anything about growing anything other than soybean.
Mm-hmm.
So, I started conversing with them, helping them out. And, I was like, well, shoot, if I'm helping them, I'm not making no money. I need to make some money here. So I went ahead and got my license and started growing some hemp out in Chanchula.
Mm-hmm.
And from there, that wasn't working out well for me. I mean, come on. I'm a one person machine. I can't run that. I can't do that by myself.
Right, right.
So, and I was like, and I started going through cancer and, had gotten diagnosed again with skin cancer. So, I mean, it was just, one thing after the next with me. And I started, looking into the CBD, looking into how it was made. And I
Mm-hmm.
was like, why can't I do this? I mean, it looks simple.
Mm-hmm.
So that's where I started getting into, formulations. And
Mm-hmm.
from there, I just ran with it.
Mm-hmm. Yeah. Yeah. And I think it's so much more personal, the story that you have because you are someone who actually, battled cancer, fought cancer, and won
Yeah.
yourself pretty much on your own, you
Yes,
know.
definitely.
So, and like I remember you telling me stories about when you would go, to doctors yourself, they would be like, all right, we know our medicine didn't work this good. What the hell are you doing?
Right.
So
Yep.
yeah,
And some wanted me to keep my mouth shut, and others said, tell the world.
yeah, yeah.
So there was a lot of mixed reviews about it. Some of the doctors stood behind me and they were like, okay, it's gone. I would love to offer this in my facility, but insurance is not going to pay for this.
Mm-hmm.
But just put it out there and see what happens. And
Mm-hmm.
that's what we started doing. We started putting, the serum out there, but it didn't just, help with that. It wasn't just that particular product. It helped with wrinkles, acne, you know, scarring, quite a few different things. I mean,
Mm-hmm.
you see, I had skin cancer on my face.
Mm-hmm.
And, as a woman or, anybody, when you have something like that on your face, with women, it's all
Mm-hmm.
about beauty these days. And to be, cut out on your face and having the biopsies and having all these scars and everything, I wanted to make something that was comparable for all of that for compromised skin. Well,
Right.
obviously I did it, I mean, it took me
Mhm.
some time. It did.
Right.
It took me a while, a lot of trial and error, you know, and I was the test dummy on this one.
That's why I'm laughing so hard because I remember times when we would talk and I'd be like, Kelly, turn your camera on. I'm not turning my camera on. I did this to my face and you ain't about to see me like that.
Oh Lord. There was that one time I had that major chemical burn off of bakuchi oil that I had tried to run with this serum. That didn't work out too well for me. But as you can see, I'm not full of scars, I'm 49 years old. So, I am
Wow.
mistaken for someone younger.
Yeah, yeah.
So I
And
mean
then
it's working for something,
yeah,
obviously.
and then you're small and you're petite as well. I know and look, and you're on a college campus too. I mean, you
Oh
get
Lord.
mixed up all the time.
Just just a little bit.
That's funny. Well, I guess we can kind of like, hop around a little bit because,
Sure.
I had some questions that I wanted to ask you, and I definitely want to open this thing up for Q&A for people. But let's kick off with like, so what are you doing at the University of South Alabama right now?
Currently, I'm not doing anything.
Okay.
Currently, we are finding some more researchers. I'm hoping to find one over the Mitchell Cancer Institute that would like to do an intercellular test on intercellular trial on the CBG.
Okay.
I've already done quite a few testing on the outer part of the skin, but we want to go a little bit deeper. We want to get
Hmm.
further in. We want to hit those cells that are underneath the skin and see
Okay.
what we can target there. We want to do, I want to do some tumor targets and
Okay.
see what formulas that I currently have that actually can target each one of the tumors.
Hmm.
I have a lot of prospects. I have a lot of interest right now. And hopefully we can get some funding for that as well.
Hmm.
But I do have quite a few professors that are talking to me about it and are actually interested finally. So if
Now,
I can get that done, it would be wonderful.
Now, what is your career path? What is your look? And when I was shooting a video the other day, I forgot.
Mm.
Is this a bachelor's? Is this a master's for you? What is
Well,
the educational path that you
I've been in college for quite a few years. I took some classes at Harvard. I went to Everglades University for uh, a different type of medicine that wasn't right for me.
have?
So I decided I wanted to go to the medical track. I wanted to go down to become a medical doctor. Currently, I'm in pre-med, which is biomedical science. It's just a fancy word for pre-med student,
Mhm.
finishing up those requestrates. And from there, I'm going to go to, hopefully, I get approved to go to medical school. I'm not
Okay.
currently in medical school. I'm still considered pre-med.
Right.
So from there, if I continue on the same path that I am, I'll probably be a doctor in approximately about 6 more years. It's a
Okay.
very, very long process.
Yes, yes.
Most MDs, it takes about 12 years to finish,
Hmm.
and I'm halfway there.
Well, I'm look, I enjoy watching your journey on Facebook. I enjoy look, the sick part of me enjoys watching you get frustrated on Facebook when you talk about all this work that you got to do and blah blah blah. You don't know how you're gonna get it done, but then you'll post, "Hey guys, I got a 99 in the class." You know,
I
It's-
know, I know. I'm a perfectionist, so I mean, I have to have that 100. I have to do it, you know.
yeah.
It's just something that it's just been instilled in my brain over the years. You've got to be perfect.
Yeah, yeah, I understand. And it's like, I think of medicine almost like, aviation because, in the military, it's like we had a standard, like I want to say the standard was it was either 90 or 95% when we took tests. Because
Mhm.
it's like, do you really want a flight engineer that knows less than 95% of their
Right,
job? Do you really want a doctor, that only knows 70%, of her job? So,
right,
I totally get it. I totally understand that because it, forces you to kind of, raise your own personal standards a little bit in order to be able to thrive and survive in that kind of environment. And, one of the things that I am really excited for was the scholarship that
yeah,
you just received, young lady,
yeah,
for
yeah.
your, like, talk to us about it. What's that all about?
Well, there's quite a few scholarships available for a lot of students out there, and I just happened to come across one, and I submitted, basically, you know, a little bit about me and what I had done over the years with CBD, and didn't submit the actual serum, ingredients itself, but um, some of my trials that I had done, some documentation that I had taken from that,
Mm-hmm.
and I had submitted that along with my personal statement over onto a scholarship, and lo and behold, I got it. I don't know how much it's going to be. They're going to let me know in, like, I believe April or May, but it's for my spring. So I won't
Okay.
have to worry about, my college expenses next semester. So it's pretty
Mhm.
much going to be covered, and which
That's
I'm
awesome.
happy about. So it gives me a little more relief so I don't have to work so hard, as
Right.
far as, outside work, and I can focus on my studies.
Right, right. Um, and it's so important that you're talking about, CBG, for those that are going to listen to this recording later, or those that are on it now, there are a lot of misconceptions that are out
Yes,
there, about things like, CBG, because, when people think about cannabis, the first thing that they think about is THC,
right,
and getting high, and there are a lot of people out there that are just unaware that CBG is pretty powerful because for the most part, it's kind of viewed as the mother molecule within the plant. And a lot of cannabinoid production starts out as CBG. And as the
right,
plant grows and matures, here come your other cannabinoids, the other things that are on that pinwheel as the plant grows. So when you give someone something that is a high CBG concentration, it has the ability to do a lot of the same things in the body with the endocannabinoid system
right,
as the THC, but without the psychoactive effect and without you failing drug tests. So,
right.
what other misconceptions about, CBG have you heard about
Well, there's quite a few differences in, CBG and CBD itself. Um, CBD is awesome. It really is. It hits on what, about 26,000 cells in the body.
it? Hmm.
Okay. CBG, probably about 86,000 compared to the CBD. So, I mean, it hits on a lot more of the cells inside the body than, CBD does. And you really don't need a lot of CBG. CBG is a more concentrated in the plant. So you don't really need a lot of it. So less is more,
Right.
you know. There's quite a few misconceptions about that. We use it solely in our cosmetics and as topicals,
Hmm.
but it does have a lot of neurological help. That is the biggest thing about it. CBD is great for inflammation in other parts of the body. It really is. But on the neurological side, CBG actually has more effects on that, and focus and different things like that. People with ADHD, you
Hmm.
know, um, there's just quite a few different things like that.
Hmm.
Um, I really don't know a lot of misconceptions because I really don't run into that with my clients. They come to me and say, okay, what's the best thing for me? And I'm like, okay, well, here's what I suggest. And they're like, yes, ma'am.
Yep, yep.
So it's all about trust, I believe.
And another one, that I know what I have been telling people, but I
Mhm.
just want to see if this kind of checks with you. I tell people when you start taking, cannabinoids, CBD, CBG, broad spectrum, full spectrum, it's like, in my personal opinion, you need to be on this stuff forever. Because your endocannabinoid system, to me, it's kind of like having a second stomach, in your
Right,
body. I mean, what happens when you go a few days without eating? You don't always feel the best, and then when
right.
you start, giving your body proper treatment, establishing that homeostasis, and then your 30-day supply of CBD runs out and you think you're cured. No, you're not cured, fool. You better keep on taking that stuff
Right,
because you
right.
need it, every day. And I think that's one of the biggest misconceptions. Is like, you need to continue to do this stuff. It's not just a
That's
one
very
hitter quitter.
true. That is very, very true. I have a lot of clients that come to me and they're like, okay, I no longer have this. And I'm like, okay, hold on. Now,
Mm-hmm.
since you no longer have this, we need to have a preventative.
Mm-hmm.
Once we go to a preventative, you can knock yourself down on some milligrams and everything else. You don't have a high potency. And then
Right.
we can just have a maintenance.
Right.
And from there, they're in a complete agreement and continue on with any kind of, protocols that I have for them. So
Mhm.
yeah, I do agree with that. So it's more of a continuous thing. You don't just want to, think, oh, I'm cured. No,
Yeah.
you know, it's the environment that we are in is
Right.
never going to allow you to be 100% cured of anything.
Right.
So with our environments, we have to take that into consideration.
Right. Yep. And I always try to joke when I tell people things, but I always tell them, like, your endocannabinoid system and an STD are two different things. Like, you can take some antibiotics to treat that STD, and yeah, you're
Right.
done with those, right? But this doesn't work like that. Like, this is ongoing. This is, continuous, within the body. So, I always like to make sure, we talk about that. Before I do have another question, but I think I can save that because we do have, we do have a couple guests, and I want to see if they have anything that they want to ask. Whoever iPhone is, I had to mute you because you had a little bit of background noise, but please feel free to unmute yourself, if you have a question. I see my buddy Theo Alexander has unmuted. So, brother, what do you got?
Yes, thank you, Kelly, for sharing your story. I think it's such an amazing thing to have a professional, especially since you're in pre-med, going through this. We need a lot more help when it comes to the research part of what cannabinoids can really do to our body and how it interrelates with the endocannabinoid system. And I guess my questions kind of center around as far as research focus. I myself and JJ probably knows this, very interested in research and development when it comes to veteran healthcare.
Mm-hmm.
A lot of times veterans are left out when it comes to multi-symptom illness, and cannabinoids, I think, can be the answer to that versus opioids or antidepressants or treating things separately. And what has been your experience as far as your ability to get the concept or the focus past the IRB or Institute Review Board when it comes to research potential? Because I just find like I'm running up against a brick wall when you mention cannabinoids as a research focus, people just get turned off for whatever reason, but they'll look at opioids and all the other stuff that comes along with it as the potential to answer questions continuously.
Well, it is definitely it's very controversial, especially with some of the older professors that I've ran into. There's again a lot of misconceptions about the cannabinoids because the first things they think about is THC. They don't like the hype, so right off the bat, first things I tell them, I don't want anything with an entourage effect. None of that. That's not what we're focusing on. I have worked with a lot of military families. There's a lot of military in my background as well. So I mean, I've always been around it. And yes, it is a even in the military community, it is very hard to get that type of help without giving them up. They want to push opioids. I don't understand why. That's a excuse me, that becomes an addiction. That is something a military person does not need. They don't need something they can become addicted to. They need actual real help. And, CBD, CBG, and different cannabinoids actually will help that. And I do plan on having some research teams on my side that will actually help with that. So that is something that we can also focus on other than my personal research that I want to do at the university. I can always put that out there. Maybe some of the professors that are older, maybe they have military backgrounds. So, you know, if I speak to some of those, they are probably more apt to do that type of research with me.
Mm-hmm.
Yes. And see, I mean, just to follow up, I'm a Navy veteran from the Gulf War era. And for 30 years, they never recognized Gulf War illness as a multi-symptom diagnosis. CDC just recognized that with ICD code, I think it's T75
Mhm.
.83 now. And that's the first time in the history of the Gulf War that you can actually go in and get a diagnostic code for a doctor so they can start to treat the multi-symptom illness. The VA is kind of slow on accepting this.
Right.
They haven't announced anything yet, but what I did look at in my research, my current research is I just want to see what were the remedies they were offering for people who had multi-symptom illness. In every single one of the 24 different drugs they were offering, depending on the category, every single one of them, 100% of them said increases homicidal and suicidal ideation, and that just kind of burned me a little bit. Why are we being prescribed these drugs? And they know that PTSD is a common symptom to most of these multi-symptom illnesses, but everything they're giving us to take increases suicidal, homicidal ideation. And I know that CBD reduces that fact, or the entourage effect, or just cannabinoids in general. And this is one of the research focus I was wanting to compare, and just want to kind of get the group's idea, or kind of your advice on how I can approach getting that in the focus, because I've tried just about everything else to get some of the VA personnel to study, just to do observational studies when it comes to cannabinoids. And I know JJ has been successful in doing some of these things, which is tremendous. And so just kind of putting our efforts together to get a little further in the future, I would love to kind of hear your thoughts on that.
Honestly, Theo, that's the whole reason why I'm going back to medical school.
Amen.
Because they don't want to listen to you unless you have that piece of paper.
Mm-hmm.
Yeah.
That piece of paper seems to mean something. And, for me going back to school and become a physician, I will be able to publish in the NIH. I'll be able to publish in any of these peer-reviewed journals. I will be able to submit all of the research that I've done and be recognized. And the more research that we can get published into the NIH, the more we're recognized. So if you can actually publish something there in the NIH, then you can be recognized and people will start to listen. And, that is actually the whole point of one of the reasons why I'm doing this.
I understand. Thank you. Thank you.
So, I mean,
In a,
we can actually do that. If we continue to do our research, you know, brain scans like JJ has done on his, he's got that posted on his website. You know, we would have to do some, trials and on veterans with PTSD. And, it's going to have to be a lot of them, not just
Mhm.
10, 20, 30 people. It's going to have to be a minimum 100. And,
Mhm.
then we got to, triple that one, So, and it's got to be in a whole. So it just can't be, like a simple, 20 to 50 people to 100. They don't listen to that. You need something more than 100 people, and it needs to be, well written. It needs to be well documented, and we need, backing from another professor, maybe another physician, someone with that credibility,
Yes.
You know,
Understood.
so
one of the things that I was gonna bring up, and I'm just bringing this up, like, am I the CEO of a CBD company? Absolutely. I'm not gonna deny that. And I'm not out here to sell people CBD. All right. I'm literally out here because I care. My father passed away from lung cancer when I was 20. But one thing that I want to get on recording for whoever sees this later on, we do have a product that both you guys have talked about. That's our Clarity and Focus
Right.
product. It's got 19 vitamins and minerals, things like turmeric, moringa, ashwagandha root, N-acetylcysteine, as well as CBD. And, just to elaborate on what we did, we paid for 5 combat veterans that had diagnosed combat PTSD to have brain scans or QEEGs done. And we had baselines with none of that formula in their system at all. And then we gave
Right.
them a week supply of that formula and had them go back and repeat it just to see how it would be. And with doing that scan, their cognitive function showed through the roof. And it's actually documented on our website on, www.activedutyrx.com. And there's a section on there called QEEG studies. Go check it out. You can download the direct talking paper from Dr. Wilson on those 5 patients. And anybody who buys that Clarity and Focus product, here's what I need you guys to do to help Theo, to help Kelly long term. Anybody who buys that Clarity and Focus product, when you buy it, on the top of that bottle, there'll be a QR code. And it says on this thing, scan to rate. Okay. When you scan this, it's going to take you to an app that's called Tetragram. And Tetragram is an app where you can actually go and rate cannabis products. You can tell, you put on there what was wrong with you in the beginning. You can talk about the duration and how the product is making you feel while you're using it. Because what that's doing is giving us a data point. It's actually
Mm,
giving us exactly what Kelly needs to move forward. Because Otha Smith, I'm in partner, kind of semi-partnership with him for us, excuse me, using Tetragram. I can reach out to Otha periodically and say, hey, bro, how many people have actually used the Clarity and Focus product? Right? What kind of data can you give me on that I can share with the world so we can see how that product is actually helping people and help give you guys that data that you need to ultimately be able to convince people of exactly the conversation that we're talking about right now. So that's one of the things that I'm trying to do to help contribute to where we're at. Like there will always be two QR codes on our products. One of them will be on the side of the product where you can scan and get to the COA, which stands for Certificate of Analysis, which is basically the report card for the quality of cannabinoids in that product. But the second QR code, that's the one for actually rating the product and letting people know how it's helping you. So I encourage everyone, Kelly, hint, hint, wink, wink, you too. I can get you linked up with Otha for your products as well, to where you can get a QR code to put on your products as people are using them to be able to collect data and get those data points. It's easy when you already have people on your product. It's harder when
Right.
people don't know anything about your product and you're trying to get people to use your product and go rate it too. So, we both have followings of people with our products. So I don't see why we couldn't continue to do stuff like that to help
Yeah,
Theo out.
that's a great idea on the QR codes to where
Hmm.
we can get a good rating and, find out, how many people are actually find it useful.
Hmm.
And, the ones that don't find it useful, is there a way that we can, kind of like ask them a question and say, how long did you take it? Things like that.
Hmm.
So is there something like that on there so we can respond to it?
I know Otha can find out,
Okay.
because like I said, they enter all this information. And, if he needs to add different categories to the data points that he already collects, he can as well. So I think as time goes on, I say we use what we got to get what we want. We already have products, they're already out there, we're already killing it.
Right.
So let's just take what we're doing to the next level and formalize data with what we're already doing you know?
Yeah, and like
yeah.
I said, getting it out there and getting it published, that is the main goal here. Once we
Hmm.
can do that, then people are going to start to listen. They're going to have
Yep.
their eyes open and they're going to know, okay, this is real.
Yep. And I want this information published, right? But until we get there, we're going to help as many people as possible so that these assholes have no choice but to
Right.
publish the data when it
Right.
shows up. They can't ignore it. You can't ignore these people by the masses forever, man. The more of them we help, the more you have to take a look. We force them to take a look at what we have. and then we say, oh, we did this. Well, what have you done? Oh, you've been over there sitting on your butt playing hee haw with the goof around gang, So that's what I think we, continue doing that, and it puts us on a great path. So,
Right.
Hey, one follow-up question to the data collection, JJ.
mhm.
Is it possible for OTA to make the current data and statistical available? Well, something that's available to me right now. The reason why I'm asking is I'm working with a pharmacologist right now, and God put this woman in my path. She's world renowned. She's worked in many different of the large scale how you say, the pharmaceutical agencies.
Uh-huh.
Now she's totally on the other side of the fence. She's promoting health and wellness and holistic medicines, things like that, herbals.
Mhm.
And we met and we talked, and she wants to help create a strategy to go after the VA to do research. And
Okay.
of course, I put active duty RX in the forefront of that, being the
Whoop
population
whoop.
work. And so if we had any data that was for utilization and
Mhm.
some, and I showed her the brain study as well, she was very
Right.
impressed with that. But
Okay.
if we have any other data that I could put along with it, we want to be able to put that in the strategy in our presentation to the
Yeah.
VA when we talk to these directors.
Remind like if I should remember, but if you don't hear anything from me tomorrow, please text me and I'll reach
Okay.
out to Otha and see, how many data points we've been able to collect, thus far for that to kind of continue that process and see what we can do to get you some because we've been doing it now for probably about like 6 months. Now, people are gonna be people, right? People be people and all day long. They'll get it, they'll use it, and they won't even think about, rating
Right.
it. But there may be a few that have, and that's what we want to, check into, and see what's what. So we'll definitely do that. I want to give iPhone, and I'm saying iPhone because all that's on the screen is iPhone. So if iPhone has any questions and iPhone would like to unmute and ask your questions, if you have any, please feel free to do so anytime. I just want to throw that out there. I don't want you to think that you don't have the ability to do that, but you do if you want. I won't pressure you, but I'm just reminding you. So while we're out here and we are let's transition to something fun for a minute that we all can kind of chime in on, I think. Uh let's talk a little bit about these THC bans and hemp is
Oh,
dying and blah blah blah, so on and such. Uh Kellie, when it comes to you know so first of all, when we talk THC, like we've got strains out there that are doing 30 damn percent THC and totally rocking people's world and knocking people's blocks off when it comes
yeah.
to getting them stoned. But when we look at medical research, people like Dr. Newton, who wrote a book on the endocannabinoid system, it's not the high THC where people are finding, therapeutic relief. It's the low doses of THC
Yep.
coupled with CBD, the THC kind of opens those pathways up for the CBD to continue to go in and do its thing and the CBG. So where are you at with this, Kellie?
Well, I mean, I agree with the full spectrum, where it has, very small amounts of the THC in it. Yes, it does hit on quite a few different types of cells in the body. And without those, it's basically like a team.
Mm-hmm.
You have to have a team, you have to have a village in order. You can't just like, your cells are like children. Okay. You can't raise your children without a team. That's just
Right.
the way it is. And THC is going to be a part of that. Now, it's not a part of everything. You don't have to have Papa over here and Grandma over here at the same time. You can have your two by side, but you don't have to have everybody.
Right.
Now, the high amounts of THC, eh, that's just for people who want to get high,
Mm-hmm.
plain and simple. It's
Mm-hmm.
people just want to forget about their day and get high and go to sleep.
Mm-hmm.
And honestly, it's not helping you any. I mean, it really isn't. What it is doing is affecting your heart. And
Mm-hmm.
whenever you take high doses of THC,
Mm-hmm.
it will affect the heart. You start having arrhythmia.
Mm-hmm.
And do you really want to do that? Come on now. You puts you at high risk of stroke. You're actually it's slowing down your heart rate. Whenever you slow down your heart rate, what happens? You don't get enough oxygen to the brain,
Mm-hmm.
increases your risk for stroke. So you don't want to take high doses of THC. You
Mm-hmm.
never want to do that. And the way they're marketing this right now, you know, putting it in these gummies, yeah, it's fine. Some people can't do that. But people with Crohn's disease, THC works, but it doesn't work as a gummy. It
Hmm.
has to be an oil. It has to be
Hmm.
as a tincture because with Crohn's disease, that's actually, it's an intestinal issue.
Hmm.
So whenever you're in that digestive tract, the gummies are being digested. Well, I mean, it's pointless, and a lot of people don't understand that.
Right.
So I'm
Right.
getting all way off on subject on that one. Lord, I don't
No,
know
you're
where that
going.
come. I don't
No,
know
this
where
is
that come from.
no, that's a good. That's coming from Dr. Austin, is where that's coming from.
I don't know where that come from. We start talking about Crohn's disease.
But then here's another one that a lot of people aren't aware of either. When we talk about the endocannabinoid system and we talk about the EC, like if you take too much THC, please correct me if I'm wrong, but this is just the way I understand it. You can actually cause paralysis in your stomach muscles.
Actually, yeah, you can do that. And how you know that's happening is you start vomiting.
Mm-hmm.
You start to have severe stomach cramps. It becomes an allergy. And once that happens, you will always have an allergy to all cannabinoids. And,
Mm-hmm.
and people have the misconception of like, okay, I got the nausea, I got the cramps. What fixes that? More
More
THC.
THC. Mm-hmm.
Wrong. That is the worst thing you can do. If you start, smoking, yeah, for just a second, it's going to make you feel better. And then you're going to start getting violently sick all over again.
Mm-hmm.
And you develop an allergy to it. And once you develop that allergy, you're just basically asked out because now you cannot take CBD, CBG, THC, none of the cannabinoids because you will always have that effect.
Mm-hmm. Yep. And kind of, keeping talking about THC a little bit. I'm gonna kick it over to Theo for a second in Hawaii because Theo told me, like, Theo is an undercover OG, right? Me and Theo have, just so you know, Kelly, Theo knows Ryan early as
Okay.
well. He knows Ryan. Him and Ryan were kicking it before me and Ryan were kicking it. So he's known Ryan a long time. And Theo was actually involved with my brand prior to me even being involved with the brand. And Theo told me a story about something pivotal that happened in Hawaii. When they were forced to take products off of shelves and things like that. So Theo, bro, I'm not gonna ad lib shit. You tell the story, like real talk. Go for it.
No doubt. And it's been a very special situation and a very good opportunity to be involved with Ryan Early when he first opened up his lab there in Oklahoma in 2016, and just watching the development of what he's done in the industry, he's putting very high quality products on the market. And so when JJ came on board, it was right for a veteran like myself to push that brand into where it needs to be pushed, and that's in our neighborhood when it comes to people who are actually suffering from being first responders or being in service uniform, then getting out and not having any medical treatment at the VA. So I immediately got behind the brand Active Duty RX, and I moved to Hawaii in 2006. So in my residency here, pretty much I came into contact with Ryan when I went home to visit my mom, who had been diagnosed with breast cancer. And so I immediately started giving her the products, which I mean, she's gotten past breast cancer. She's in remission. And of course,
Awesome.
she's continuing to take the cannabinoids, both the THC, they call the Rick Simpson's oil, as well as the products. She's on the some of the cardio cleanse other products as well. But Active Duty RX here in Hawaii has been a special situation because a lot of the people I deal with as a member and a post commander for AMVETS Hawaii is given those guys who have the multi-symptom illness and PTSD that's undiagnosed or sometimes undertreated or not treated at all, and seeing their response with the clarity of focus was very amazing to me because each one of them would come back within a week and say, "Man, this stuff is amazing. This is the first product I've ever taken that I didn't have any side effect. I didn't get high, but I got some the relief and the sleep that I was wanting. You know what I mean? And their life has somewhat returned to normal." And in that transition from maybe about the years of 2017 to 18, when the farm bill and all that was like on everybody's first of mind thing to follow, here in Hawaii, they started to ban all the CBD products because there was a huge import from overseas with things that have a lot of heavy metal, a lot of synthetics. Sometimes what was on the bottle was not in the written on the bottle was not in the bottle. It's a very unsafe situation. So the Department of Health came out and took everything off the shelf. The only product that was stayed on the shelf with no situation as far as denial of the product being what it is the active duty RX and the pure cannabis product line. And it just proves to people that there is real CBD medicines out there. And the fact that most of the medicines that come out of that lab are sold behind the pharmacy counter for over the counter sales just tells you the high quality of what the active duty RX, how it's produced, and the effects. And the fact that, the ingredients that are listed are right there in the analysis reports. And now that we can take data and, I'm saying, on the utilization of it and your feedback from it, that is super. Because that is the data that's missing. The patient never has the opportunity to do testimony that's really tabulate, just put in data tables and, where people can read. These are actual factuals. It may be the person's opinion, but the testimony speaks all for the patient when it comes to their experience with the medication. Did your pain get reduced? Did your inflammation get reduced? Are you sleeping better? That's very important to the patient and doctors that listen. And so, I mean, that experience just let me know that there are some fake products out there. People were injured because they say fake products. Poison control was called all the time in that era. And so now they're really careful. The health department's really careful of what they allow to come to Hawaii. Because Hawaii is like almost a third world nation, as far as importing things here or bringing things into the market base over here. They had that experience to where people were really pushing the monetary value of having a cannabinoid on the shelf versus the right cannabinoids that have been analyzed and looked at and scrutinized. So my experience with that just showed me that I had one of the best products, if not the best product on the market, and it continues to be that today.
And like when you told me that story, like I had a aha moment because it was around that time, Kelly, when we started. Hawaii's already been through what we're going through right now in the U.S. in terms of the THC bans and whatnot. And for there to, whether it's my product, Kelly, your product, whatever, for there to be a product that can literally withstand all these regulatory entities and still be on the shelf when all the others are pulled off, that lets
Mhm.
me know, Kelly, that you're on the right path when you're doing
Right.
things with CBG research and not quite so much THC focus. Yeah, we want to keep THC in there as well
Right.
because, it takes mom and daddy to raise a family, right? But at the same time, it's like it has to be balanced. There has to be an ebb and a flow, and there has to be high quality. There have to be high quality products and great research, like what you're doing, to continue to lead the charge for the future for where we need to be.
And something, JJ, that I have found out, our heard Theo over here mention the Rick Simpson oil, the RSO. And RSO has been, widely distributed as a cure for cancer. Okay, it is used for that. It is, we can't say that it actually does that, but that's what it's been widely marketed as. Now, I love RSO, Rick Simpson oils, freaking top notch. I give him all the props there on that. But he researched his own type of cancer. He did not sit and go through. Do you know how many cancers are actually out there?
Yeah,
Okay.
yeah.
Now, here's the problem with it. In the Rick Simpson oil, there is a high amounts of THC in it. Well, there are certain cancers that whenever you hit high amounts of THC will actually cause cancer growth. But actually,
Wow.
it won't inhibit the cancer growth. It actually, it will just start targeting it, and the cancers will mutate and mutate over and over again. Certain cancers. Now, breast cancer, yes, it does need a little bit of THC in it. So that's awesome. Okay. There are certain cancers that do need the THC, but there's quite a few out there that do not need it. And
Mhm.
that's what I do. I
Mhm.
research and find out what cancers need the THC, what cancers need the CBD, and what cancers need the CBG. How much of each one of these cannabinoids is needed in order to target those cells.
Mhm.
And then that protocol is put into one particular formula. Once I know each one of these cancers, what those requirements are, then we start to formulate because not every cancer requires CBD. Not every one requires THC. Some may require a combination of 4 or 5. Some may need just a combination of 1 or 2. You
Mm-hmm.
know, and that's where I stand on that. I'm not saying nothing negative about RSO, but people think that just because it does treat quite a few different cancers, or they use it for that you can use it for all the cancers, and that is just simply not true.
Yeah. Yeah.
Understand. That's
Yeah.
good information. Thank you for saying that because, and with my mother, I mean, it was more for nausea and keeping her
Okay.
appetite, a healthy appetite, and providing some form of reduction of inflammation because she did go through chemo at Mayo's Clinic up in Rochester, and
Right.
so we went there and stayed for more almost a year for to go through her treatment. But the whole time I had to go to battle with with her oncologist there because it was a younger guy, you know what I mean, and he had never heard of, saying cannabinoids, and so I
Right.
I just kind of walked him through what cannabinoids do and where they're located, and I showed him they're on the formulary, they're just synthetic. And so when he saw that, and I gave him some research as far as their system, their patient card system there, which my mother had a card, so we went ahead and took care of all that before we moved up there. And so I had to just kind of, I had to break him in. We almost got into an argument at one of her appointments because he would not accept what we were saying as far as what we need and what we have already agreed that's going to happen. And so eventually, when he went and asked the older doctors and he looked at their policy on cannabinoids and things like that. And then he understood. And now this guy is one of the leading guys researching exactly what you're doing with Mayo. You know
Mm-hmm.
what I mean? And that's the kind of impact we have to make as patients when we don't give ground to doctors who think they know, but they don't know.
Mm-hmm. Yep.
They know
Yeah,
what.
I mean, there's a constant educational curve that a lot of doctors have to get. And it's a constant re-educating ourselves.
Yes.
We have to keep up with all the new scientific evidence out there, the new drugs that come about, is all the new research, and it's constantly evolving.
Yeah.
So, and a lot of these doctors, they don't necessarily have time to do all the research. They've never
Mhm.
heard of some of these things. And, RSO is a great complementary medicine for each patient. It really is. It helps with the pain, it helps with inflammation. And like you said, it helps with, being able to eat, because, everything you put in your mouth tastes like metal, or
Right.
makes you sick, and you don't want to eat. And, part of that RSO and the THC helps, give that appetite, give that hunger, say, okay, I want to try this. And because we have to have the nutrients, we have to have those amino acids and all that while we're going through any type of cancer treatment.
Yes. Just one more question for you. In with your academic research at this point in the courses, um, they have John A. Burns School of Medicine here for the MDs and the clinicians to go. They have a few electives where they teach them holistic medicine because Chinese herbal medicine, Hawaiian ancient herbal medicine is a big thing
Yep.
here, the whole market. And so they have
Yeah.
to know a little bit of something about it because most of their patients they will encounter are doing some of these remedies at home. But with the endocannabinoid system itself, how much do they really teach up and coming physicians about the endocannabinoid system? It's there in their.
Zero.
Wow, that's.
Zero. I've taken quite a few years of alternative medicine at Everglades University over in Florida. And we've learned about the Chinese medicine. We've learned about Ayurveda medicine. We've learned about all the non-traditional medicines out there.
Yes.
Um, plant medicine, all the holistic aesthetic medicines, all the way down to chiropractor. We've learned all of that. And zero, I mean, zero touch on
That
any
is
type of cannabinoid system.
that is crazy. Like that is so damn crazy. I know why I'm not gonna go into all of the stuff with the Rockefellers
Ah,
and petroleum base. Oh, sorry, go ahead.
but at University of South Alabama, they currently do have a program for cannabis, on the campus currently. I
Hmm.
don't
Oh
know how
wow.
long that is going to be there, considering the new rules and regulations, well, South may not allow it because of the
Kelly,
rules.
if
So
if
if it
someone needs
disappears,
if
do
someone
we
needs
know
to
where to turn?
if someone needs to come and speak on hemp 101 across the entire multitude of the cannabis plant, I think I know a guy that can assist you that
Ah,
lives in
we do.
Mobile that knows quite a bit about it. This dude even taught his seminar to a gubernatorial candidate.
If
He
if this is threatened at the university, which I will check on to make sure, if it is threatened that they're going to pull the program, which I don't know if they are, this is just my assumptions because of what's been going on here lately. But if
even if they
there there's
don't,
if there's
even if they
talk
don't,
about it, I can speak to them over at the
yeah,
Mitchell Cancer Institute.
even if they don't want to pull it, if they just want the information, I know a guy that will come out and do
Well,
that, Kelly. Just
I
keep that in
believe
mind.
I believe the program is certifying bud tenders, but don't quote me on that. I'm not
Yeah.
sure. I haven't looked quite into it as much.
So with that being, so here's what's happening a lot. You have a lot of patients that are going in to see physicians, and that patient will say, I've heard about this stuff called CBD. The physicians think they're talking about THC.
Right.
Mm-hmm.
No, they're talking about CBD, not THC. So, knowing that this is a recording and who knows who's going to listen to it later on, what do you recommend for these patients that walk in and know? Because I know what I do when I speak to my physician about things, but I want to see what do you recommend these patients do when they're dealing with a physician that may be adverse to, you know, talking to them because they can't prescribe it, right?
Right.
But in terms of having the conversation, how do you recommend that patient breaks those walls down?
Actually bypass that patient and go straight to the physician and give them brochures on how CBD with alternative medicine can help a patient,
So
in
what
case
I'm
that
saying, so you're
patient
saying
does
for that
come in.
patient, you want that patient to give the brochures
No,
to their doctor?
no, I want people
Okay.
like us to go in and help educate the physicians, hand them brochures and say, look, if any of your patients come in here asking about this, here's some information that you can actually give them. So we
Right.
need to bypass the patients and go straight to the physicians.
Gotcha, gotcha. Because so I'll tell you a little bit about what my process was like when I was referred by the VA to a pain management doctor that knew nothing about it. Like, let me tell you what,
I
look,
can
this is,
imagine on that one.
oh no, this is crazy, right? So I'm literally in there with him. I'm telling him what's going on with my back, right? And I'm telling him that I'm currently on CBD supporting CB1 and CB2 receptors for the endocannabinoid system. He turns to me and he's like, "What's that?" I was like, "You don't know what the endocannabinoid system?" He was like, "No, I haven't heard of that." I was like, "Well, the endocannabinoid system is in fact the master regulatory system for the body. You think about your circulatory system, central nervous system, your respiratory system, your endocrine system, they all receive inputs from the endocannabinoid system, right?" And I talked about CB1 and CB2 and giving cannabinoids, and he was very impressed that just, this old veteran patient knew this information, right? So I literally gave him this information, and we exchanged numbers, and a couple days later he literally sent me a text message. And I told him, I was like, this stuff has been in the medical books since the late 80s and the early 90s, but it's not traditionally taught to physicians in medical school because it can't necessarily be monetized.
Right.
And he was like, huh. And this is an anesthesiologist. Okay.
Right.
And he was like, huh. So he went back and looked up some stuff himself. And then a couple days later, he texted me, and he was a veteran. And he texted me a couple days later, and he was like, hey, bro, you're right. This stuff is in our books, and I didn't know about it. So I was able to meet with him again, gave him one of my roll-ons for he wanted to try it for himself. And he tried it, and it worked, and it alleviated his conditions. I say all of this to give people hope because that physician who was not educated at that time was Dr. Tristan Lai, who is my partner now for my brand. And because of him, my all of my products are physician backed.
Right.
you know.
Right.
So it's possible to break through, but I feel as patients, you just can't walk in right now and say, I want to try this CBD stuff. No, you got to walk in with some knowledge to spur them to go to the books and look up stuff for themselves. Because otherwise, you're going to get hosed,
Right.
period.
Right. I've had some doctors tell me, said, look, you try CBD for that? And I'm like, do you even know who you're talking to? I mean, actually one of my vets, I had one of my pets, she surgery after surgery, we could not we were having a difficult time saving her.
Hmm.
And, he went through quite a few years of holistic medicine, acupuncture, and all kinds of stuff like that. And he said, look, I know you do this CBD stuff. He said, try it on her, see if it works, see what we can do. And,
Hmm.
we tried it on her, and I've had, she lived a pretty good long life
Hmm.
after that. But I'm like, yeah, do y'all really know who you're talking to when you're gonna tell me? But I've actually had a couple of doctors, say that to me. Would you,
Yeah.
try it? So there are some out there. There are some in Mobile, definitely.
Hmm. Hmm.
Um, my mother, when she goes to her oncologist, she flat out tells them, my daughter helped me when y'all couldn't,
Hmm.
and they're like, who's your daughter? What did you do? And she's like, should I say it? Should I not? And, she'll just blurt it out there. She'll like, well, she gave me this, that, and the other, and it worked. And, she's cancer free right now. She's in remission as well.
That's awesome.
So I think, she had stage 4 rectal, yeah,
Mhm.
stage 4 rectal cancer.
Wow.
That was, yes. Yes,
Wow.
they gave her a very, very limited time to live, and she's okay now.
Wow.
She's okay.
See, that's why you are a blessing, Kelly, is
Mhm.
because you have done so much with your, because every testimony starts with a test, TEST, right? You've done so much prior to even diving into the
Oh,
professional
yes.
world. You know,
Yes,
this is
definitely.
where you were meant to be. This is what you were meant to be doing. And I am proud to call you a friend, for what you're doing and your efforts and just everything that you're gonna do. Like, seriously, thank you for sticking through uh or should I say, staying the course, and being tougher than a 50-cent steak, and not giving up and continuing, to go on and proceed. And I know, before we kick this off, I know you were like, JJ, I don't know where, I don't know how we're gonna make it through, an hour's worth of information. Guess what, Kelly? It is officially 7:02.
Yes. Thank you. I did it.
Boom. We
I did
made
it.
it. We made it. I think it was great. And once again, whoever iPhone is, okay, iPhone, if you can't unmute your mic on your end, I'm gonna hit this button here. It says ask to unmute. If you have anything that you want to add before we get ready to disconnect.
Yeah, James, this is Bill Anderson at South
Hey,
Dakota.
Bill, what's up, man? How you doing?
Doing good, doing good.
Good.
Yeah, I written down some questions here, and one at the top here is in the cancer world. They have messed up so many people with radiation and chemical poisoning and whatnot. How does the hemp and CBD work to fix or help those folks? Has that been researched? Another one that I'm going to throw out there is the world research. It's almost like there isn't anything out there. I would have surprised that I think countries like France and well, Nepal,
France,
they grow so much of it.
Israel, they're all whipping our ass in research because they never stop doing it when we
Okay.
have close to 100-year history in this country of not doing it, at least talking about it in public.
Yeah, yeah. Well, so is there a lot of stuff that we should be gleaning from them and bringing here, or we just need to go back and reinvent the wheel here?
Well, Let's go, Kelly. You want to talk about the first part to his question with the
Sure.
treatment and the burns and whatnot?
I developed, severe burns from the radiation.
Mhm.
I actually, lost section here, in my jawline. So I do understand where you're coming from on that. I haven't seen any research, any pending research or anything like that, but University of South Alabama is building a very new, as we speak, a research facility on campus. It's very large. We originally, they were going to, house only like 80 different types of students in the medical department to do their research. Well, now they're going to bump it on up to, 100 more researchers. So we're going to have that. It's a state-of-the-art facility, so we're going to have access to a lot more equipment, a lot more state-of-the-art technology. So, I mean, these are some things that we can actually put into play and throw out there. Now, as far as anything out there that would help patients, basically recovery from radiation burns or any of the other elements caused by chemo and radiation, to be honest with you, I don't know.
You know, I would probably venture to, so when we're talking about, skin burns and things like that, that's primarily CB2, right?
Well, what he's talking about is an internal burning.
Right. Uh-huh.
It's burning of your, basically your organs and your systems. Like for me, it burnt my nerve endings inside of my jaw. When you burn your nerve endings, what happens is the bottom of the tooth starts to die.
Right.
And once those die, then you lose them.
Mhm.
Which they ended up causing to do a rebuild on my jaw because I'd lost those nerve endings. So I had to have reconstructive surgery on my jawline
Mhm.
because of the radiation. So that's what he's referring to is, these
Mhm.
internal burns on, different types of organs caused from the chemo radiation.
Okay. Okay.
Um, I want to just step in real quick. Give an example of my experience with caring for my mom when she came. She had radiation done right there in Integris Health in Oklahoma, and it burnt her chest so severely. They gave her something like I think it was a emu oil to put
Yes,
on there to take care of the damaged tissue, and that stuff just inflamed it even more. Animal fat, it's just like putting butter on a burger,
right.
right? And so, one of the products that Ryan makes, the Identify product, the eye cream specifically,
Okay.
a
Yeah.
very light CBD CBG
Mhm.
formula, and I had my mom use that. She had tremendous results on that, taking the inflammation or the pain out of the burn and helping the skin to come back pretty quickly. And that was really the only thing that we found as a remedy. So as far as the internal part, can't speak to that, but the topical part, she had tremendous results by using that CBD oil with the CBG.
And
As
that
far
was the eye serum,
it
right?
was ice, it was the eye, yeah, serum, the cream. You know what I
Okay.
mean?
Yeah. Yep. I
Because
know
it was
what you're
very
talking
light,
about.
you can spread it over the skin,
Yeah.
and because everything that touches your skin, as you may know, Kelly, it just
Right.
really irritates you. You know what I mean? It's almost like fiberglass in your skin, and
Yeah.
she couldn't sleep. She couldn't wear
Yep.
any garments. You know what I mean? And so it was really uncomfortable for her. And so that was really the only thing that we found a remedy in. So I would say that if we did more research around radiation and burns like that with the cannabinoids, I think we would have a huge level of success.
And
Well, you got to have a gentle type of oil, the natural oil. That's, part of our skin serum formula actually helps with the compromised skin, like with your mother there. That's an external part, you
Yes.
know. So when we do have things for the external cells, we do have that out there. We can get it out there. The biggest thing is the intercellulars. That's what we need to really focus more on because there's nothing really out there that shows any scientific evidence, and we need to put that scientific evidence out there. That's
Mhm.
what we really need to focus on and get published. And we've got a lot of products out there for, topicals that includes the CBD because it does help enhance the healing process a lot faster. And the natural oils in, like I said, probably JJ's and that cream it's probably got a lot of natural oils that help with that burning sensation on the outer part of the skin.
Right. Right.
And Bill, if you need something like that, please let me know. It's not my product, but it's my partner's product. I have access to it. I can get that. It's not a problem. One thing that I wanted to do before we got off here, Kelly, if anybody needs to get in touch with you, what email address do you want to provide, or what do you want to give out in terms of people to be able to contact you directly in the future?
Contact me directly, probably going to be by, let's just go with this email.
Okay.
And it would be Kellie Austin 295 at gmail.com.
So Kellie
Uh-huh,
Austin
295 at
295
gmail.com.
at gmail.com. Okay,
Yes,
cool. I just want to make sure people know how to contact you directly, because I don't need everybody blowing me up after this,
right.
being like, hey, how do I get in contact with Kelly? Nope, it's on a recording. It's toward the end. Go check it out. And we got a little visitor there, huh?
Yeah, I got a little baby kitten.
Oh.
So she's just being nosy. She
It's
likes
all
to
good.
sit with me a lot.
Yeah.
She was a little
So
stray, so
well, this has been awesome. Bill, did you have any, are you good now? Did you get all your
Yeah, I guess back with that is that um, I've considered radiation just basically cooking them, So yeah, it comes from the outside, and you got the skin burn that you see, but I envision that the tissue inside has been cooked
yes.
and damaged and whatnot. And then I've also, and maybe this is a misconception, but have thought of the hemp as something that either stimulates or supports stem cell activity, and thus it helps the healing process. So that's why I would think that it would be something that every cancer patient would be using right now at some level.
Yes, we would love to have it as a, complementary to any type of chemo and radiation. Because
Mhm.
it does support, faster healing. And it does support a new cell growth and the good cells, not your bad mutations.
Yeah.
And so, yes, that is something that would actually help others.
Kelly, is
Mhm.
there any particular cannabinoid that does enhance that new cell growth, or is it just a full spectrum in general that you've heard
Um,
of thus far?
it's kind of more of a full spectrum on that.
Okay.
That I would say that across the board.
Okay.
Without knowing the person individually, not knowing what type of cancer they have, things like that, I would just go ahead and go straight across the board and do a full spectrum.
Gotcha. Okay. Cool. Okay. All right. Well, guys, this has been awesome. Kelly, we were actually at an hour and 13 minutes currently,
I
so
see that.
we've done good.
You
You
saw
done,
see that.
as they say in Alabama, you done good, girl.
Well, thank you for having me, JJ.
You are very welcome. I hope this was something that would give you a little bit of, little bit of bearing, and let where you at, get your feet wet, with talking to people about things and whatnot. I want you to keep on keeping on, and you always got my support. So
Yes,
please,
sir.
just let me know. Theo, thank you for, I know the time difference is crazy over there, so I appreciate you taking time to come out, spend this with us as well. Bill, I appreciate you always, man. And if you guys ever need anything from me in the future, please let me know. But this is how we're gonna wrap it up. I appreciate everybody coming out here, and when I have more interesting things to talk about, we'll come out here and we'll gather, and we'll talk as time goes on. So with all that being said, I hope everybody got enough Halloween candy and got all that out of their system this past weekend. It's a new week. Do your water cleanse, get all that stuff out of your system, and let's go out and be great people.
Man,
Awesome. You have a
Right.
good night.
All right,
Thanks,
you guys
JJ.
take care. Yes, sir. Y'all have a
Yeah.
good evening.
have
Okay
a
then.
good one.
You too. Bye bye.